I am Mohab from Rawa Health Services. Today I want to discuss regarding cochlear implant. So I am going to meet with cochlear implant specialist Dr. Kunal Nigam. So I am entering the room. Hi sir, how are you? I'm good sir. So I just wanted to discuss regarding cochlear implant. Okay sir. Okay sir.
Hello everyone, I'm Dr. Kunal Nigam, Head of Department at Shalby International Hospital for ENT, Voice and Cochlear Implants. Thank you Mr. Abdul for coming here. Thank you so much. Today you want to know about cochlear implants. So cochlear implant is a very simple thing. There are three companies that deal with cochlear implant. One is Advanced Bionics called as AB. This is American. This is by the name of Cochlear only. This is Australian. And this is Medel by Austrian. So one, two, three companies. They are the only companies that make cochlear implants. Now, in cochlear implants, what is cochlear implant? How does it function? Cochlear implant comes in two parts. One is the outside part, one is the inside part. This part we do surgery and we put it inside, and this electrode goes inside the cochlea. After that, this is the outside part. After 7 days of doing the surgery, we put this that is called a switch on, in which it attaches like this with a magnet. The outside part will have two types. One is like this, where we put like a hearing aid, and second comes without the thread. This is called as off the ear. So it gets attached like this over here. So this is a sample for cochlear. This is a sample for Advanced Bionics, which has stuff. They have also same. This is the implant, and they have same like this. It gets attached to this. But in this, they don't have off the ear like cochlear. This is also like this. This gets attached over here, right? So this is for this company. Similar for this company.
They don't have off ear.
They don't have off the ear. Only Cochlear and Medel has off the ear. Like this type they don't have, but Medel has. It's called as Rondo. Now, if you see this picture over here, so like we said, if we show this, this is the part inside which goes over here inside the cochlea, and this is the part where we attach over here. This is console 2, this is console 3, and this part is something like this, which gets choice of the patient. Now, cochlear implant has many models from minimum to maximum, depends on the budget, depends on the patient's choice, the child age and everything. Second thing, the most important question they ask is 1 ear cochlear implant better or 2 ears? Always you should do 2 ears. It is always better. But because of money, because of finances, we say you do 1 ear and then you do the other ear the next. It will be always better. So every patient is different. How to know which is the candidate for cochlear implant? If a child is born deaf, within 3 to 5 years, we should do cochlear implant. It have very good results. Or if a child is born, little hearing is there because of meningitis, because of something, and the child is wearing hearing aid, after that, cochlear implant is also good. If there is an adult patient who was hearing well, speech is good, but due to some reason his hearing became less, whether it's old person, young person, then also we do cochlear implant in which hearing aid is not responding. Same with the child was hearing before, but hearing aid is not responding, then we do cochlear, or child is born deaf. So in these categories, we do cochlear implant. They have very good results. But after cochlear implant, you have to do speech therapy and auditory therapy for 6 months is very, very important. So this improves hearing and the speech. So these are the two things. I hope it has been able to explain everything.
If the patient is more than 9 years.
Yes, if the patient is more than 9 years, we have to see three things. A, is there any speech of the patient? Is the patient using any hearing aid, any SAMA? Third, and how is the test, MRI, CT, BERA, how's the response? Based on that, we will say A, if cochlear implant will help the patient, or B, will not help the patient. This we will test after doing these things.
Okay, sir. Thank you so much, sir.
Thank you. Thank you.